There are many therapies available for pulmonary hypertension. That's a very individualized decision that the patient and their doctor needs to make. There are many things that we consider when deciding upon a therapy. Some patients are less advanced at the time they're diagnosed and are appropriate for some of the oral therapies that we have. Some patients are much more ill and need to go on really the strongest therapies, which are often delivered continuously into the vein. The therapies that we have right now available for pulmonary arterial hypertension work in three different ways. There are the endothelin receptor antagonists, which are oral medications that block a substance that tells your blood vessels to constrict down. There are the prostacyclins, which are the more complex medications. Those are the ones that are delivered either into the vein, under the skin, or inhaled, and they tell the blood vessels to relax. And then there are what we call the PDE5 inhibitors. Those are oral medications, again, that tell your blood vessels to relax and improve the blood flow through those vessels in the lungs. The therapies for pulmonary hypertension are very effective, but patients can have different responses. And the treatment of pulmonary hypertension is really a long-term treatment. We have treatments for this disease, but right now we don't have a cure. So you need to work with your doctor and your nurse to really assess how effective that therapy is for you. Our goals of therapy include improving your symptoms, usually shortness of breath, improving your quality of life, treating any heart failure that you may have, trying to keep you out of the hospital. And as you start a therapy, keep all of that in mind and work with your physician and the rest of your team to find out if that's really the best therapy for you. This will require office visits, perhaps 6-minute hall walks, and an honest assessment of what that treatment is doing. And if you haven't improved enough, and that's a decision for you and your doctor, you need to think about other therapies that might be beneficial for you. Pulmonary hypertension is a disease that we've learned a lot about over the past several decades. Sometimes patients get nervous or concerned because of some of the things they've read based on the NIH registry that was done back in the 1980s. And we've come a long way since the 1980s. Patients are doing much better than they did then. We have many different options, and you really need to work with your physician to figure out which of those options is best for you. And while we have all of these new options that work in these three different pathways, that's really just the tip of the iceberg. There are many more pathways that we don't fully understand and some that we are starting to understand better and looking at therapies for. There are a number of clinical trials available right now for pulmonary arterial hypertension patients, and our hope is that if these trials show that these therapies are successful, down the road we'll have even more therapies than we have today.